friends. I am intending to create a 3-part video series on barriers to mental health. And what I mean by that is 3 things that I've personally identified as something that can get in the way of having good mental health. So this first one is access, and then my second one is financial, and then you. So this first one, access. This could mean a number of different things. This could be access to therapy, access to medications, and there are quite a few different ways that this can happen. So sometimes the access issue might be that there just aren't any practitioners around, or in some situations the correct practitioner. So if you need a specific type of child psychologist, maybe there's not one in your town or even an hour away. A lot of times the practitioner we need is too far away, and for situations where you have trouble with transportation, that could be a really big deal. So transportation is an issue of access. In some situations, most people are going to have access to internet and a phone, but in some extreme cases, or in a really rural environment, that might not be an option. So in my jobs, I have worked with people that don't have a phone and don't have access to internet, and that could be a huge challenge in a mental illness. The cost of mental care can prevent you from accessing the service. However, I'm doing a separate video on financial because it's a big one. And okay, so what can you do to help with this issue of access? First thing is, if you have a job, the first place I would always check is to contact your HR person and ask if you have any free sessions offered through a partnership with the company. And you can say it's for someone else if you're worried about letting them know or something. But many companies have partnerships where you can get 3 to 5 free sessions with someone they've identified, a practitioner they've identified. So that's always a great place to start. The second great place to check in would be your local health and human services department. I know that some are separate in town, some have kind of their own health department, some have their own human services type thing. In some states, like where I'm living right now in Utah, Department of Workforce Services runs all of the like food stamp, public assistance type programs. So whatever that looks like in your state, go there to see what resources are offered. A lot of times these government organizations will have a great list of resources to get you connected, whether that is a specialized provider that you need, or you need help with the finances, or sometimes even getting somebody in home. That one is definitely a much bigger challenge, but there are sometimes therapists that will come to you in your home. Okay, another great government resource to check into is if you have a 411 type of number in your state. Here in Utah, it's 211, and they do a great job with it in this state because they have a website, they have an app, and you can, of course, call the number as well. And they have a huge amount of resources that are you can ask about on the phone or on the website. Everything's categorized, so if you need something relating to mental health, you can look that up. Fabulous resource, so definitely look into that as well. Okay, another great option for our day of connectedness online is that many therapists are available to do phone calls or Skype calls. I have even seen texting advertised. So that is a great option if you can't go in person or lacking transportation, something like that, that is a wonderful option. And a lot of times you don't necessarily need to be in person. Having someone over Skype is great too. All right, and finally, talking about access to medications. This is a tough one because a lot of times access to medications is a financial barrier. But again, similar to a mental health practitioner, if there is not easy access to a doctor in the area, or if you don't have insurance, this can be a problem for a lot of people. So I will talk a little bit about alternatives in this video, just keeping in mind that I, again, am not a professional. So you have a responsibility to always do your own research and make sure that what you're doing for yourself is something that you believe is safe for you. And in most cases, you probably should be working with a professional. Again, the reason I'm doing this is because I know that it is not always within someone's power to work with the doctor. So I think that a good alternative to medications is some type of supplement. Again, this is something you need to be careful with, and I've found more success with this with a nurse practitioner. However, there are a couple things that have a decent amount of evidence. Omega-3 supplements have definitely been shown to help with an improved mood, so could help some people in cases of depression, and that's a supplement that Dr. Lardy mentions in his book, The Depression Cure, which I've mentioned before. So that is something I think that, you know, it's not a big deal at all. It's a vitamin. So I'm not going to go into a huge detail on those alternatives, maybe in a later video, but they're definitely, excuse me, those alternatives out there. And I'm going to talk a little bit more of alternatives to therapy and medications in my, either my financial video or my You video, because it doesn't quite fit into this one yet. So I will talk about that. So be sure to join me next time on my video about financial barriers. All right, friends, I hope that this was helpful to you, and comment below if you have any questions or suggestions, something that you've done that has worked, or ideas for future videos. All right, thanks. Bye.